Good afternoon, everyone. This is Mark Calhoun. I am the Director of Social and Community Services. I'm here today with my partner in crime.
Hi, this is Daniel Myers, Program Director for MATSUD. Glad to be back in the saddle again. Giddy up, giddy up.
Yeah. Giddy up, absolutely. And this is the CareSouth Carolina Community Live Podcast. We have a special guest in the building with us today. Yes, we do. We have none other than Miss Jennifer Lynch, family nurse practitioner for CareSouth. You know what? Let me shut up. I said last week I don't like talk for people. Remember I said that? But I ain't just going back on that now. So I'm going to let her introduce herself and tell us a little bit about herself. Miss Jen?
Well, my name is Jennifer Lynch. I have been here at CareSouth for 6 years now. And I'm a family nurse practitioner, and I do anything from children to the elderly. And we also have a very special department within our clinic here, the IV therapy department. And we developed the IV therapy department about 5 years ago, and that really is where my passion lies within CareSouth.
Wow. Can you give us an idea about your IV therapy department, about what type of things you do in IV therapy now?
So it first was developed originally just to be able to help prevent patients from going to the ER for simple things like IV fluids because of dehydration, or they needed IV antibiotics. And then it developed more into IV iron, where other providers within CareSouth and even outside of CareSouth could refer patients to here versus the hospital for IV iron. And then within the last 3 years, we've actually started infusing biological drugs through the IV for diagnoses such as multiple sclerosis, rheumatoid arthritis, ulcerative colitis, and Crohn's disease. And we get a lot of those referrals from the outside specialist, and we're able to infuse them here in a more home-like environment versus in the hospital.
And so IV therapy, it really is a convenience to the patient, of course, right? Mm-hmm. Because they're not sitting in that hospital or ER setting. And it's also outpatient. So when they finish that, they get to go home.
That's right. That's right. And it's also for a lot of Medicare patients, if they went to an outpatient infusion center, they pay a $350 copay for that infusion. And here they don't have to pay that. And so it actually saves them money as well. Not to mention, we have a pharmacy here on site that we can utilize to get the medicines at the discounted rate.
Wow. So 340 is covered up in the 340B as well. Is that what you're saying?
Correct.
Oh my goodness. So that is a convenience. That is a wonderful thing to offer, not only our patients, but to other people in the community as well.
That's right. Because a lot of these medications for diseases like multiple sclerosis are $24,000. And that's very expensive and hard to afford. And when we can convince an insurance company to pay us, $12,000, that's a big difference.
Right. Oh my goodness. Well, so just say if, for instance, I know there's a lot of questions I get sometimes. A lot of people who has blood pressure issues and take diuretics, right? Mm-hmm. And so they have the potassium depletion. Do CareSouth manage that as well?
We can. We give IV potassium and IV magnesium. Those are the two most common electrolyte deficiencies or abnormalities that occur.
Okay. That's good to know. That's good to pass along, right?
That's right. And we have the capability. We have actually 2 IV rooms. One holds 6 chairs and the other one holds 4. So we can actually run 10 people at a time. We have 3 registered nurses, Shannon Almond, Cindy Davis, and Joe Reynolds. They are all registered nurses with critical care experience, many years of experience. And they run that department with Shannon Almond being the coordinator. She kind of manages the insurances and getting people scheduled and getting their medications approved through the insurance. And just recently, we've actually been able to think about expanding to the old pharmacy within the Hartsville site. So we're hoping the construction starts on that soon, and we're going to have a bigger space.
Wow. So how long does it usually take, for this kind of therapy?
So different drugs take different amount of time. I mean, yesterday we had a patient that had to get a special drug called Rituxan. So she was one-on-one with our nurse Joe, and she was here for 6 hours. But some infusions only take an hour, some take 2 or 3. But it just depends on the drug and what the protocol is for that particular drug.
Okay. And is there a waiting list for this department?
As far as patients, no, there's not. We're actually, we do pretty good about trying to get people in same day if we can, if they get a call from their doctor's office. And if not the same day, at least the next day.
Okay. I want to see if Marek got anything to say. I don't want to do all the talking and all the question asking if he got something he want to say.
I can tell it sounds like, from what she's saying, sounds like y'all are really expanding it. I remember when you first started in that little small room, used to be a file room over there on that side. And it's like y'all getting ready to expand into the old pharmacy. That's big time.
It is. We're really excited. We really are able to change a lot of people's lives over here. And, we've taken MS patients from being in a wheelchair to walking again. And so we're very proud of this department, and we're very excited about the things to come.
Yeah. So Marek, you want to go ahead and just, let's go ahead and break the ice and just go ahead and open that can of worms that we was talking about that we're really excited about. That. Go ahead, man. You know it.
Yeah, we're gonna go ahead. So last week, and exclusively broke news on here last week. We felt like, I don't know, I'm a sports guy, so I felt like we were breaking news on ESPN or Fox Sports or CBS Sports. That's just us. But she talked about a new treatment that we just got approved for at CareSouth Carolina that's going to make the difference in the lives of many people dealing with this pandemic here.
Yes.
Talk about it. I'm going to let you have it. You talk about it.
Talk about it.
In November of 2020, the FDA authorized the use of monoclonal antibody infusion therapy for the treatment of patients with COVID. And at first, we were only seeing this done mainly in the hospital setting, in the outpatient hospital setting, some nursing homes and whatnot. But actually, we were contacted about if we could do it. And they were shocked to know that at FQHC actually has an IV department. And we're the only one in the nation. And so that's very exciting. And I'm very excited that we're getting to do this. But we're still trying to educate, because a lot of people don't know what this big word means. And basically what monoclonal antibody infusion therapy is basically lab-made proteins that we infuse into the patient through an IV that gives the patient, it actually mimics the patient's immune system and gives them the ability to fight off deadly pathogens like COVID-19. And the patient does have to be positive for COVID, and they have to be within the 10-day symptom period for it to be most effective. And it really needs to be mild to moderate disease. If the person's already been hospitalized or they're requiring oxygen because of COVID, that really makes them no longer a candidate. But if they're 12 and older and they weigh 44 kilograms or more, they really are a candidate for this therapy. And the biggest thing with it is preventing people from being hospitalized with COVID. It's preventing ER visits 28 days after diagnosis of COVID, and then ultimately preventing deaths from COVID.
Wow. I know some people probably get lost whenever you say the 44 kilograms. We know that's 88 pounds, around 80-something pounds, right? So,
that's right.
What are some of the side effects?
So the infusion itself takes an hour, and then we monitor them for an hour afterwards. And what we're monitoring for is any type of infusion related reactions. And those are things like nausea, changes in blood pressure, changes in oxygen levels. We're monitoring all that through the infusion. But generally speaking, that people do really well with this, and they have really mild side effects that they're really already usually having those symptoms with COVID anyway, like nausea, vomiting, and headache.
Now, I know monoclonal is new to the COVID arena, for treating this, but I know it's been several studies done on other diseases as well.
Right.
And for some it proved very, very well, and for some it didn't do so well.
That's
we know
right.
it was tried for HIV as well, and it didn't do as good. But for something like this, for this viral infection, it does very, very well because it does a good job at duplicating, artificially duplicating itself to look just like our immune system or our immune.
It mimics the immune system. That's correct.
And so, what are some of the common side effects with just IV therapy that people can look forward to by getting this?
Well, of course, getting a needle stuck in your body anywhere never feels good. So you have a little bit of discomfort from an IV. And then, of course, some bruising and maybe some redness. But hardly ever do we get those phone calls afterwards. And we do follow up with these patients. We actually got the shipment in on Tuesday, and we've infused 11 people. I'm doing number 13 right now. Sorry, 13 people so far, with 2 more to come in today. And so we're really excited. We've been calling and checking on everybody the day after and days to come, just making sure everybody's okay. And everybody has been thus far. That's been appropriate for therapy. They've done well.
So I got a question go ahead, Marek. I see you want to ask something. I'm sorry.
No, I didn't want to skip over this because I want to make sure I heard something right. So I'm gonna need her to repeat this.
Okay.
Did you say we were the only FQHC in the nation? All 50 or 51 states. I don't know. It's 50 states. Yeah, I know it's 50 states. All 50 states, including the territories of Puerto Rico, Guam, and the Virgin Islands, to have IV therapy.
That's correct. We're the only one to have an official IV therapy department.
Well, you just broke news here today.
Once again, you heard it first. You heard it first right here, right, Marek?
Yes. You heard it first here. Only FQHC in the nation to have an IV therapy lab. Wow.
And I actually learned when I was talking to one of the directors that with the program that actually gave us the medicine, he said, they've been wanting to do this since December to expand the monoclonal antibody treatment to everybody, to people without insurance and to people that don't have enough insurance. And they really haven't been able to find a setting to do it in. And they wanted to do it in the FQHC world, but it was going to be so much effort to get someone set up to be able to infuse, because we have to have, of course, emergency equipment in case someone does have a reaction. And you have to have the right nurses and the right experience in order to do it. And so we were able to, within a day, get approved and get going.
That's because CareSouth is already a champion at healthcare. So most of the things, I'm pretty sure, I'm just guessing, I'm just assuming because I know how awesome we are, right? Because we are, right? Number one, right? So it's almost obvious that we had the correct EMT response system that we can call 911 and get somebody there. We had AEDs, we had those, we had the crash cart available, emergency drugs. So CareSouth was already ready for this. It pays to be a company that's ahead of its time, that's very innovative. Right.
Absolutely.
I'm hoping Ann watching this because I might be able to get some brownie points, get a little raise. Okay, but that's besides the point. The point is that we getting people what they need when they need it, especially during this pandemic when so many people are losing their life and they're losing family members. This is that another sun ray of hope that gives us a hope that we can soon get past this and we can get back to a sense of normalcy. With the vaccine being issued right now at CareSouth, and in majority of our sites and majority of our counties, and with this new treatment coming on board, man, I can see daylight. You know what I'm saying? I can see clearly now. The rain is gone. If I can sing, I was saying that. You know what I'm saying? But you understand what I'm saying? And having champions of healthcare like you, being the provider that you are, being awesome. Being able to do this and take care of your other patients. Hey. Thumbs up. I had 4 thumbs. I'm raising my toes. My toes up too. You can't see them, but I got big toes up. Right?
Thank you.
Yeah.
I know as a provider, this is probably the first time since the pandemic I've really felt like I can actually help somebody with COVID now. I'm not just telling them to go home and quarantine and drink plenty of fluids. I actually have an option that I can offer them here in the office. And it's really nice. It really is. I'm very blessed. I'm very humbled and thankful that I get to do this. And I've been able to do it this week. And we've had such positive results thus far. And we really just want to get referrals and just get these people in here that really are high risk, that need it the most.
So Ms. Lynch, what are, okay, just say if I come in for an appointment, right?
Mhm.
I'm feeling bad, I'm displaying some of the symptoms of COVID, and I test right there. You find out that I'm positive, right? I'm an employee, so I'm going to get a rapid test. Okay, so you find out right then, and I'm positive.
You can actually get a rapid test if you're not an employee, if you're a candidate for this infusion, because it's
okay.
so time sensitive.
Okay, great. So what if I'm right in your office right then, and you have availability? How possible is it for me to get that treatment today? Is there a waiting period? I mean, is there
No, there's no waiting period.
So
No.
I can possibly get it right then.
Right. And we're doing that right now, actually. Someone walked in, they had a positive test, and he's now going to get the infusion. And we're gonna always have room for walk-ins. We've actually designated one side of our office for this, to separate our well patients from our COVID patients. And we have 3 separate exam rooms that are set up just for these infusions, and we're rotating them out pretty quickly and efficiently. And we're able to infuse quite a few patients at the same time and able to monitor them safely. So absolutely, we want to do that. We want to, the second we diagnose them, we want to start it as soon as we can, because we know that's the best possible outcome for the patient.
Wow. Okay, so suppose I'm negative Nancy, right? Mm-hmm. And I come and I'm like, well, because there's a lot of talk about all these different things going on, all these conspiracy theories, right? They want to put something in your body to run your mind. They're going to make you look like a chicken and cluck like, whatever. Okay, so how can you ease my anxiety about this new drug that's first of all that is man-made, okay, and it's being put into my body? How can you ease my mind about getting this treatment because it might save my life? How can you do that?
Well, prior to actually doing it myself this week, all I could do is present the data to the patients. And we have a folder, and we're bringing it into the room with everybody, and we're going over the data, we're educating, and we're explaining how it works. And, we're letting them look at the studies with us. And then this week after giving it, I now have a little bit of personal experience about how kind of things have gone, because I've infused mild to moderate patients with all different types of comorbidities. So I have a little bit more I can speak on. And I really just try to plant that seed. And I've had some people say no to it and call back 2 days later and want it. And that's okay too. It's all about educating and just planting that seed and letting them go home and think on it and, talk to their families as well and make their decision. And, we're here for them whenever they do make that decision.
Well, is there anybody that's not a good candidate for this type of therapy?
So if it's been longer than 10 days from symptoms, it's not going to benefit them. If they have already had to be hospitalized and let out of the hospital, they're not a candidate. And of course, if they are having to already use oxygen because of COVID, then it's really not appropriate for those patients.
Okay, so oxygen depletion and ventilation is that just throws me out. That disqualifies me. Okay, and if I'm past 10 days. In my symptomatic period, then it's probably best that I just go ahead through the process, right?
That's right.
Instead of doing this. Okay. All right. Am I right?
I wish I'd have known, but I wish we had this when I was positive.
I know.
I was so miserable.
Yeah. Yes. So this is going to really help a lot of our elderly patients. I think it's going to be a big benefit to them. And it's going to give us some peace of mind knowing that we can actually get somebody that we love into treatment and not lose them, to this illness outside of getting the vaccine. So this is, like I said, I'm just excited to be a part of CareSouth at this point in my life, where we're doing the latest and greatest. And like I said, once again, giving shouts out to you. But this is not a small undertaking. Anytime you're dealing with IV, I understand that there's a lot of monitoring. There's a lot of things that could go wrong if you're not properly trained. There's a lot of infections that can happen, but I know CareSouth is very, very.
And in 6 years, we've had 0 infections related to IV, related to port access. We actually have a 0% infection rate among our ports and our access, and we're very, very proud of that. That's probably the thing I'm most proud about, is that we've never had a port get infected here, or a PICC line, or any IV access. So I'm very proud of that, and the fact that we're very diligent at taking care of things the way we should.
And that's why I wanted you to say that, because I want people to know just how awesome we are, right? And so people probably say, well, why he's so big on CareSouth? Well, it's a sad fraud that don't praise his own pie. You know what I'm saying? And so, we got to let people know what we are doing and how we are here for the people in our community, people that we can help, that we know we can offer something to you. But right now, in some places, they don't have this option.
That's right. You don't have to be a CareSouth patient, and there's even some patients that have tried to call and refer themselves, and that's fine. We'll call their primary care and get the referral form done, if their primary care sees fit. just calling and asking about it and just seeing if you're maybe a candidate or your family member may be a candidate is really the first step.
Yeah.
Yes. Yes, that's exactly what I was going to ask. Knowing that you're housed in Hartsville, what area? Well, I don't know if I can answer. Never mind. I don't know if I can answer that. I was going to say, what areas are you seeing patients from? I guess you can answer that because there's no PHI.
So really from all over, we've been like Chris Lane sent a referral yesterday. So it was a LATA, and he's really good about supporting our IV therapy all over there in LATA. They've had a pretty good increase of COVID positive patients. Of course, Bennettsville area has sent us some, and as well as Society Hill.
We getting a little bit from all over the PD. So like you said, we didn't have to be a patient of CareSouth. Just give us a call, and your team will work behind the scenes to get any authorizations they need to get done and any referrals they need from their provider.
Yep. And it's no cost to the patient at all.
No cost to the patient.
No cost to the patient.
Let's repeat that again. Let's repeat that again for the people at top, please. Say that one more time.
There is no cost to the patient.
Oh my goodness. Well, can you get like a reserve? Can we get like a standby IV? Just yeah.
I know.
That is wonderful.
Yeah.
I'm excited, Murray. How about you?
I'm very excited. I mean, this is yeoman's work, and this is being able to, like you said, decrease the hospitalization, because we know, if it gets so bad that you have to go into the hospital, that's not a good thing. That's that it gets scary at that point, right? And having this infusion, and it's going to help keep them out of the hospital, and it's going to improve their condition and lessen the effect of COVID. I mean, this is yeoman's work. It really is. And I am proud of CareSouth Carolina, and I'm proud of Ms. Lynch and her team for putting forth the therapy and having it available at no cost, right? At no cost. And we can't stress that enough. You don't have to be a patient of CareSouth, and it's at no cost. As long as you got you. I'm sorry, go ahead.
I'm very proud to be a part of this team, and all of my IV therapy team are putting themselves at risk of taking care of this patient and being exposed to this horrible virus. We're just wearing all of our PPE, and all of our staff over here has been very well trained in making sure we wear the right PPE and the proper PPE so we can protect not only our COVID patients, but ourselves and our well patients. And I'm just so proud of the sacrifice they're making, coming in at 6 o'clock in the morning and not leaving at 6 o'clock at night to be able to serve our community. And I'm really blessed and humbled to be part of such a wonderful team that truly are salt of the earth.
That's right. I think if CareSouth was a movie, it would be the original Star Trek, because we're definitely going where no man has gone before, right? We're doing things. We're doing things that no person ever done before. We'll also be the $1 Million Man, because we're making things better and stronger for our community. So we will be the $1 Million Man as well. But getting back to what you said about Murray, but getting back to what you said about.
I love you, bro. He's supporting. I love it, though. I love it.
So you said we're the only one in the nation. Now, in our nation, as of 2018, there was 19,000, almost 19,500 cities and territories in the United States. So we assume that we've grown some since then. But out of all of those, Hartsville right now is the only city with FQHC that's providing this. In the whole, all of those 19,000, maybe 20,000 cities right now, we're doing it.
Yeah, when I asked for the workflow, it even came up because I said, well, what's the workflow of other FQHCs and how are they doing it? Let's don't reinvent the wheel. Let's just see how they're doing it. He says, well, you're going to be inventing the wheel. You're the only one in the nation. So
go ahead on Caveman Jennifer. Go ahead on Caveman Jennifer. I tell you, we rolling now.
That's right.
That's what I'm talking about.
Yeah, man.
That's what I'm talking about. That's so wonderful. And again, like I said, I can't praise you and your team enough. CareSouth Carolina for bringing forth this type of therapy. It's wonderful.
Yeah, I'm excited. I'm just waiting to see what our CEO, Miss Ann Lewis, brings to us next. because she's out there. She's trying to find the best things, that everything is going to be a benefit to our communities. She's out there, she's boots to the ground every single day, ears everywhere, trying to find out what we can do. What can we do as far as our part in eradicating this pandemic in our, service areas and abroad. And I really commend her for being that type of person, that go-getter that she is for our company.
Absolutely.
Yeah. So, Ms. Lynch, is there anything you want to say in closing? I know we got something we're going to ask you later, but right now, what you want to do? What you want to do to compel the people to come and see you? And
if you have a COVID positive test, pick up the phone and call our number 843-758-0044 and just ask. The worst thing that we can say is that you're not a candidate, but at least you've asked and you can find out, and then we can go from there and see what we can do to get you infused and get you taken care of. Like I said, CareSouth patients, non-CareSouth patients, and like I said, we'll work with people that are, don't need to have insurance or money. It's not at cost. So all it is at this point is a benefit.
Wow. All right. Well, Rick, I guess you can answer the most important question we ask anybody on this show.
Absolutely. Then I just want to make sure I clarify something. The infusion is no out-of-pocket cost to the patient, but if they do have insurance, we do charge an administration fee, right?
The administration fee only, right? And the insurance pays it. And it's correct.
Yeah. Okay. I just want to make sure that's clarified. But yes. Let's see. The most important question that we ever asked on this show.
Oh goodness, I'm scared.
Huh?
I'm scared.
Wait, Mark, let me get this part. Don't be scared. Don't be scared.
Oh, no, don't be scared. On those days, outside of Mrs. Lynch's working at CareSouth, working in the IV therapy lab, what does Miss Lynch like to do for fun?
So I have a 8-year-old daughter, and she's very involved in dance, and we enjoy being involved in part of a dance company, Brenda Crankford School of Dance, and we enjoy doing that together, and we enjoy our animals and being outside, and that's what I enjoy. I enjoy my daughter the most.
What kind of animals y'all got?
We have a shorty bulldog named Gracie.
Okay.
We have a German Shepherd.
Okay.
And we have 2 Tomcats.
Oh, wow.
Okay.
Okay.
Oh, you got some animals around there.
Yeah, you got some nice animals around
Yeah.
I imagine y'all stay busy.
Yes, we do. The good kind of busy, though.
Yes.
That's good. That's good.
Right.
That's good. That's so wonderful. I used to could dance.
My Rick. Now I still can get on the good foot, right?
I can get on the foot, but I don't know what to do. That is so wonderful, so wonderful. And we appreciate you sharing that with us. We like to, have our guests talk about, like I said, what are the things that they do outside of work, because, we work in a stressful environment, especially the last year or so with COVID, and you have to take time to depress and time to do some self-care. So that's very, very important that we stress that to our guests and folks out there that's on the front lines and just everyday people, Mm-hmm. Yep. So we definitely we thank you for coming on the show. We hopefully we can get you back on a later date once the infusion, monoclonal infusions, start ramping up, and we can get you back and we can do an update with us, and we just sit back and we can have a good old time. How about that?
That's right.
Thank you so much for inviting me and letting me share our department with you and all the wonderful things that we do, not just during COVID, but we've been doing for a while now. So we really hope this gets the word out and we can be utilized more.
That's right.
Absolutely. We would definitely do that. We will make sure that we do our part as the CareSouth Carolina Community Live Podcast to make sure that word gets out. Here the last couple of months, we've been dedicating the show to making sure that we educate folks on the vaccine, educate folks on COVID. And so now this is just another layer of that, be able to educate folks. Absolutely. And also direct them to treatment, right?
Right. Absolutely.
All right. So,
that's right.
So thank you again. Thank you again. We'll, like I said, we'll do our part to try to get the word out and get as many people here for you to help as possible. So again, we thank you for being here, and we look forward to having you again.
Thank you so much.
Yep.
Happy weekend. Have a good weekend.
You do the same.
Absolutely. Stay on when we end if you don't mind.